everyone. Welcome to today's PHO rounds presentation on Legionella risk management and investigation in healthcare facilities. My name is Jenny Kim, physician lead at Public Health Ontario, and I have the pleasure of moderating today's session. And as we begin, I want to first acknowledge that we are meeting virtually today, but the land on which many of us are gathered for thousands of years has been the traditional territories of the nations that include the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. The Mississaugas of the Credit are the treaty signatories and stewards of the land on which we are meeting today. With Toronto on the territory of the Dish with One Spoon Wampum Belt Covenant, being on the territory, an agreement that meant that the Anishinaabe, the Haudenosaunee, and the other allied nations in this area would care and share the land. Where I am personally in Toronto, I acknowledge that this territory is governed by Treaty 13, also known as the Toronto Purchase. And today this place is still the home to many First Nations, Inuit, and Métis peoples from across Turtle Island. And I'm so grateful to have the opportunity to gather and work on this land. All right, and with those items, I want to now introduce our speakers. It's now my pleasure to introduce Kelly Briscoe, Maurice Coppin, and panelist Anna Majuri for today's presentation. Kelly Briscoe is a senior program specialist on the environmental and occupational health team at Public Health Ontario, where she supports Ontario Public Health units during Legionella investigations. She's a certified public health inspector with over 18 years of experience in the environmental health field. Maurice Coppin is a communicable disease consultant at Public Health Ontario, where he supports outbreak response, disease surveillance, and environmental risk assessments. He has led and supported Legionella outbreak investigations across Ontario, contributing to environmental sampling strategies, exposure location assessments, and mitigation efforts. His work informs provincial best practices and strengthens Ontario's public health response capacity. Anna Majuri is one of Public Health Ontario's microbiologists with expertise in outbreak investigations and environmental microbiology. Included within her portfolio are Legionella-related investigations and testing. She is a clinical microbiologist at Public Health Ontario and will not be speaking today, but has graciously made herself available to answer Q&A some questions as they come up. Okay, and without further ado, I want to pass the baton to Maurice to begin our presentation. Thank you, Maurice.
Thank you, Jenny, for the introductions. Today, Kelly and I will be discussing Legionella risk management and investigations in healthcare facilities, managing Legionella in man-made water systems, and investigating any associated cases is a complex process. Given our limited time today, we'll focus on key concepts and practical approaches to help you better understand the management and control of Legionella in healthcare settings. Next slide. This presentation was created by the authors and/or external organization. It will be published on the Public Health Ontario's PHO's website for public use as outlined in our website terms of use. PHO is not the owner of this content. Any application or use of the information in this document is the responsibility of the user. PHO assumes no liability resulting from any such application or use. Next slide, please. Neither I nor Kelly have any conflicts of interest to disclose. Next slide. Okay. For today, our learning objectives. By the end of this session, participants will be able to describe how Legionella may contaminate human-made water systems within healthcare facilities, discuss Legionella management, including public health case classification, environmental investigation, and mitigation strategies, and describe laboratory support for Legionella investigations. Next slide. To start, I'll provide a brief overview of Legionella, what it is, how it behaves in water systems, and why it poses a risk in healthcare environments. I'll also share some Ontario-specific contexts, including relevant data and surveillance frameworks. Next slide. Okay, here is a brief background on Legionella. The bacterium was first identified in 1976 following an outbreak among attendees of an American Legion's convention in Philadelphia. Those affected developed a severe form of pneumonia, which was later named Legionnaire's disease. Interestingly, a milder illness caused by the same bacterium, Pontiac fever, had been documented earlier in 1968 among individuals who worked or visited the healthcare department in Pontiac, Michigan. However, it wasn't until the 1976 investigation that public health officials were able to link Legionella as the causative agent for both diseases. This marked a significant milestone in our understanding of this pathogen. Now, closer to home, and some of you may recall this, in the fall of 2005, an outbreak of Legionnaire's disease swept the Seven Oaks home for the aged in Toronto, infected 70 residents, 39 staff, 21 visitors, and 5 other individuals who lived or worked nearby. 23 residents actually died in that outbreak. The population that primarily presented with severe illness and fatalities were elderly residents and staff, showing the connection why we need to pay some attention to this disease. Please keep in mind that the name legionellosis refers to both Legionnaire's disease and Pontiac fever. So both manifestations will be described later. Next slide. Now let's have a broad epidemiological look at legionellosis in Ontario. So this graph shows confirmed legionellosis case counts and rates per 100,000 population across the province, comparing data from 2024, the purple line, with the previous year, 2023, that's the bluish line, and the average rates from 2019 to 2022, that's the dark green line. The main takeaway here is, as you can see, there's a clear seasonal trend with case counts and rates peaking during the summer months, particularly in July. This pattern is consistent across all the years that's shown on this graph, which aligns with what we know about Legionella thriving in warmer temperatures and stagnant water conditions. Now, in 2024, the case counts were notably higher than in previous years during the summer. This suggesting either increased transmission or improved detection or both. These trends highlight the importance of proactive risk management, especially in healthcare facilities during warmer months. Understanding these patterns helps inform our public health response, including surveillance, prevention strategies, and timely investigation to mitigate exposure risk. Next slide, please. Okay, so moving on, we will now look at the clinical presentation and legionellosis investigations. Next slide. Let's look at how Legionella behaves in the environment and how it can lead to disease. So Legionella are gram-negative bacilli found in natural water. The clinical disease occurs when susceptible individuals inhale or aspirate aerosolized water that contains significant sufficient dose of the bacteria. The reservoir for Legionella is typically a compatible water source, and Kelly will get into that. While these bacteria are widespread in nature, outbreaks are most often associated with human-made water systems like cooling towers, hot tubs, and plumbing systems where conditions can support bacterial growth. Importantly, transmission occurs from the environment, not from person to person. This means our focus in public health and healthcare settings needs to be on the environmental controls and water system management to prevent exposure. Now, most exposed individuals do not get sick. According to the CDC and World Health Organization, many people who actually inhale or aspirate Legionella contaminated water do not develop symptoms. A bit of information here, there are more than 58 different recognized Legionella species, and less than half of those can actually cause illness in humans. Next slide, please. Now, let's take a closer look at how Legionella can present clinically. So as I mentioned, there are two main manifestations. There's Pontiac fever, and then there's the Legionnaire's disease. Both manifestations share common symptoms such as cough, fever, or chills, malaise. You have muscle aches and headaches. These are considered the clinically compatible signs and symptoms. Now, Pontiac fever is the milder of the two manifestations. It does not involve pneumonia and typically resolves on its own. The incubation period ranges from 5 to 72 hours. Yeah, sorry about that. The incubation period ranges from 5 to 72 hours. With most cases appearing within 24 to 48 hours. Legionnaire disease, on the other hand, is more severe and includes pneumonia as a key feature. Additional symptoms may include confusion, nausea, and diarrhea. The incubation period is longer, between 2 and 14 days. Most often around 5 to 6 days post-exposure. Now, understanding these differences is important for timely diagnosis and appropriate public health response, especially in healthcare settings where vulnerable populations may be at greater risk. Next slide. Let's look at how Legionella is diagnosed through clinical specimen testing at Public Health Ontario laboratories. Now, urine collection during the acute phase of illness is used for urine antigen testing. This method specifically detects Legionella pneumophilus serogroup 1 and has relatively quick turnaround time. Results are typically available within 2 days. Next, it's the lower respiratory tract specimens, such as sputum, bronchial wash, or lung tissue, and can be tested using PCR. This method targets Legionella pneumophila and other Legionella species, with results available in up to 4 days. Culture testing is also performed on the PCR-detected lower respiratory specimens, as well as referred culture isolates for confirmation. While this takes longer, up to 15 days, the important thing here is that it allows for identification of species and serogroups, and it's essential for outbreak investigations. These cultured isolates can be further analyzed using sequence-based typing or SBT to determine their relatedness to environmental isolates. These diagnosis tools are critical for confirming cases and guiding public health investigations, especially in complex settings like healthcare facilities. Next slide. Okay. When investigating legionellosis, it is important to consider whether the case may represent a cluster or outbreak. This is typically defined as 2 or more cases that are epidemiologically linked by both location and time of exposure. Environmental sampling plays a key role in these investigations, especially when a potential common source has been identified. While routine environmental sampling isn't always recommended, healthcare facilities are exceptions due to the vulnerability of the population and the complexity of water systems. In these settings, even a single case may warrant a more thorough investigation, including environmental sampling, to identify the potential source and mitigate exposure risks. Now, these practices are guided by provincial resources such as Public Health Ontario's, we have a Legionella frequently asked question document, and the Ministry of Health Legionella investigation reference document. These documents outline best practices for case and outbreak management. Next slide. Now, from the healthcare perspective, let's have a look at how to define healthcare-associated Legionnaires' disease, which is key. This is a key concern during investigations in healthcare facilities. Now, cases are always classified according to the provincial surveillance case definition outlined in Appendix 1, which is covered next. So a case is considered presumptive healthcare associated if the individual had a continuous stay of 10 days or more in a healthcare facility during the 14th day prior to symptom onset. So this suggests a strong likelihood that the exposure occurred within the facility. A case is classified as probable healthcare associated if the individual spent any portion of the 14-day incubation period in one or more healthcare facilities. So it doesn't have to be a specific healthcare facility, but it does not meet the criteria for a presumptive case. So these cases still warrant investigation, especially if other risk factors are present. So when we talk about risk factors, the risk factors for Legionella, we're looking at individuals over the age of 50, smokers, and those with underlying conditions such as diabetes, lung or kidney disease, cancer, or individuals who are immunosuppressed. And these individuals are more susceptible to infection. Also, these personal risk factors are important to consider when assessing exposure and potential sources. And just to add a little bit here, so suspected healthcare associated Legionnaire's disease cases, so cases within a healthcare facility, should be asked about visitors or family members with compatible signs and symptoms for Legionnaire disease, since the healthcare facility could be a potential source of exposure and subsequent infection. Next slide, please. So to meet the confirmed case definition for legionellosis, which is essential for surveillance and public health response, a case must present with clinically compatible signs and symptoms such as fever, cough, and other respiratory or systemic symptoms. In addition to the clinically compatible signs and symptoms, there must be laboratory confirmation. And the laboratory confirmation can be achieved in several ways. So we're looking at isolation of Legionella from clinical specimens like lung tissue or sputum, or detection through antigen testing. Next, a significant rise or a high standing antibody titer in paired serum samples, which indicates a recent or ongoing infection. Detection of Legionella pneumophilus serogroup 1 antigen in urine, which is widely used and accepted method for confirming infection. So these criteria helps ensure accurate diagnosis and reporting, which is especially important in healthcare settings where timely intervention can prevent further transmission. Next slide. So in addition to confirmed cases, we also recognize probable cases of legionellosis, which are important for public health surveillance and outbreak response. So probable cases present with clinically compatible signs and symptoms also, but the laboratory evidence does not meet the criteria for confirmation. So in this case, we're looking at laboratory methods used to support a probable diagnosis include nucleic acid amplification techniques like PCR, as well as staining methods such as direct fluorescent antibody, DFA, or immunohistochemistry, IHC. While these tests can indicate the presence of Legionella, they may not provide definitive confirmation. So despite all of that, right, The probable case plays a critical role in public health investigations. They allow for timely response during outbreaks and are included in provincial reporting requirements. The Ontario Ministry of Health provides clear case definitions to guide local public health units in identifying and managing these cases effectively. Next slide. So to mention here that legionellosis, it is legally reportable. It's a legally reportable disease of public health significance in Ontario under the Health Protection and Promotion Act Regulation 135-18. This means that all confirmed cases must be reported to public health authorities to ensure timely notification and response. Each case is investigated individually by public health units, and these investigations help to gather detailed information. So information like such as the travel history, potential exposure, the clinical presentation. This all supports surveillance and helps to monitor disease trends across the province. Accurate and timely data collection is essential for effective disease control. This allows public health authorities to identify patterns, to detect clusters, and respond appropriately to potential outbreaks. Public Health Ontario plays a key role in supporting this process by providing protocols, guidance documents, and bulletins that help standardize reporting and ensure consistency across jurisdictions. Next slide. So a little bit more on outbreaks. So when it comes to Legionella outbreaks, outbreak case definitions are not one size fit all. They're tailored to the specific context of each outbreak. This flexibility allows public health teams to respond effectively based on the characteristics of the disease and the exposure setting. Cases within an outbreak are typically classified as either confirmed or probable. This classification helps ensure accurate identification and reporting, which is crucial for guiding the investigation and the response. So the infectious disease protocol provides the framework for health units, supporting both standardization and adaptability in outbreak management. So this guidance helps to ensure the investigations are thorough and consistent across jurisdictions. So ultimately, having the flexibility and responsive case definition supports the timely identification of sources, effective mitigation strategies, and prevention of further transmission. So in the complex healthcare setting, these are all essential components in the outbreak, in managing an outbreak, if one is for a potential outbreak. Next slide. Okay, so far we reviewed the organism's transmission, clinical presentation, including Pontiac fever and Legionnaires' disease, and diagnostic methods used at Public Health Ontario laboratories. We also discussed case definition, outbreak investigation, and protocols, and the legal and surveillance responsibilities of public health units. I will now hand over to Kelly to speak about Legionella in the environment. Thank you, everyone.
Great, thank you, Maurice. So we will now discuss the environmental aspects of Legionella. Next slide, please. So as Maurice mentioned, Legionella bacteria naturally resides in many freshwater and soil environments. However, it becomes a concern if the bacteria is able to enter a water system, is provided with optimal conditions for growth, and has the opportunity for aerosolization that can lead to human exposure. Legionella can enter water systems in a variety of different ways, often from external disruption to the system. So depending on the type of system, this can come from things like construction work, like a water main break, any repairs to the system, or even changes in water pressure. Legionella can also survive municipal water treatment, and once it gets into the water system, it can survive in the building distribution systems if it's provided with the right conditions for growth. These conditions include a suitable temperature for multiplication,
and ideal temperatures for Legionella growth is between about 20 to 50 degrees Celsius. A lack of chemical disinfection levels, such as chlorine, a source of nutrients, which can be from organic matter or iron in the plumbing. Also, the stagnation of water or any scaling and corrosion within the water system. All of these factors can lead to biofilm growth, and biofilm can protect the bacteria from any external stressors like temperature and disinfection. So a water system or source that's been contaminated with the Legionella bacteria then needs a means of creating and disseminating aerosols that contain Legionella. They're then inhaled or aspirated by a susceptible host, which then potentially results in illness. So it's not just about the source of the bacteria that's important, but also the conditions that allow it to survive and multiply. So if we can remove these conditions, we can help prevent growth. Next slide, please. So generally, the main sources of Legionella that we just looked at falls into three main categories: potable water systems, cooling towers, and non-potable water systems such as spas and decorative fountains. We'll go through each one of these in a little bit more detail. Next slide, please. So the first type of source that we'll look at is potable water or building water systems. So Legionella can be quite prevalent in larger building water systems. And there's a number of factors that contribute to outbreaks in large water systems, such as systems that we see in larger hospitals or long-term care homes. So they're often really complex water systems and have long sections of potentially small diameter pipes, which can provide quite a bit of surface area for biofilm growth. There can also be old plumbing that can be a concern, as it can experience corrosion and scaling that can lead to biofilm. There can be heat transfer due to uninsulated pipes that can lead to temperature decreases of hot water, but can also cause temperature increases in cold water, providing those favorable temperatures for Legionella growth. Poorly insulated water tanks can also lead to these temperature fluctuations. There can also be redundant pipework or dead legs or dead ends in the plumbing, and this can lead to stagnation of water, again, allowing for biofilm growth and biofilm to establish. Stagnation can also be affected by water use or intermittent water use and the type of the setting. So if you consider the water distribution in a private home compared to a facility that's at 75% occupancy or capacity, there may be rooms or wings that are not in use or have been repurposed that can lead to water stagnation in the plumbing system. So all these characteristics encourage biofilm growth, reduces temperatures and levels of disinfection, which can all lead to biofilm growth and Legionella proliferation. Next slide, please. So this image shows somewhat of a simplified schematic of a recirculating potable water system, depicting the recommended temperatures at various locations in the system. So to prevent the conditions that would allow Legionella growth, it's recommended that cold water temperatures are maintained below 20 degrees Celsius. Hot water heater or tank temperatures are maintained above 60 degrees Celsius. And the hot water temperatures that's distributed throughout the system to the endpoint or the point of use should ideally exceed 50 degrees Celsius, with some recommending above 55 degrees Celsius in healthcare facilities. Now, this can be a challenge for long-term care homes and healthcare settings to maintain those hot water temperatures without presenting the risk of scalding to residents and patients. So depending on the setting, there may be legal requirements for hot water temperatures to not exceed 49 degrees Celsius at the point of use. But in healthcare settings, thermal mixing valves can be considered to maintain water temperatures throughout the system while preventing scalding. And a thermal mixing device or thermal mixing valve is essentially a device that is used to blend hot and cold water together at the point of use. However, because of this blending of water, it provides it ideal temperature and conditions for Legionella growth at the point where the water is blended. So it's important to install thermal mixing valves as close to the point of use as possible to minimize the time and distance the water has to travel and remain at these warm, higher risk temperatures that would allow for Legionella growth. Next slide, please. So as seen in the polling question, and likely you've seen in the news over the past summer, cooling towers are also considered a main source of Legionella. These images here just show examples of rooftop cooling towers that you may see on larger buildings. So cooling towers can be part of a centralized cooling system for large buildings, including long-term care homes and hospitals. And most cooling towers operate seasonally during the warmer summer months when it's hot outside and cooling demands inside are high. So very simply, these structures contain water and fans to remove heat from the air. If Legionella has had the opportunity to enter a cooling tower system through the environment, an inadequately maintained system can provide an environment that's favorable for the growth of Legionella. And this includes warm water temperatures and sometimes minimal to no chemical disinfection. The fans that are in the cooling towers that you can see in the images here can then spread the bacteria by aerosols or droplets of water in the air. And the aerosols can remain suspended in air for prolonged periods of time and can travel considerable distances depending on the weather and wind patterns at the time. So if cooling towers are not maintained properly, they can result in large community outbreaks, which was seen this past summer with an outbreak locally in London, and also a large outbreak that happened in New York. Also, as Maurice previously mentioned, that large and devastating outbreak at a long-term care home in Toronto back in 2005 was associated with a cooling tower at the facility. So really proper operation and maintenance of cooling towers is very important in preventing Legionella growth. And there are resources provided at the end of this presentation that would support recommended operation. It is worth noting that most window air conditioning units and car air conditioning units do not use water to cool the air, so they're not a risk for Legionella growth or spread. Next slide, please. So our non-potable water systems are also considered a potential source of Legionella, and these include systems like decorative fountains. There's a number of concerns with decorative fountains. They often lack any type of chemical disinfection. There can be minimal to no maintenance protocols for these systems. They're not regulated in Ontario, so there's no operating requirements. They may also have underwater lighting, which can create a source of heat, which would allow for warmer water temperatures, which would then be ideal for Legionella. They often produce aerosols, so if Legionella bacteria enters the system, it can be dispersed in the air, and there have been cases associated with fountains. The CDC recommends not having a decorative fountain in areas with high-risk individuals, such as long-term care homes or hospitals, as they're not considered to be necessary, and they do present a Legionella risk if they're not maintained properly. So if you do happen to have a decorative fountain in your facility, ensure that it's cleaned and disinfected regularly, and it's recommended to keep water temperatures cold, ideally below 20 degrees Celsius. If you can click ahead, please. So spas and hot tubs have also been associated with cases. The water temperature of spas or hot tubs is warm and ideal for Legionella growth. While operation of public spas is regulated in Ontario and disinfection is required, the disinfectant is rapidly lost because of the high water temperatures and the high bather load relative to the amount of water. Spas and hot tubs are often equipped with jets and air blowers, which can generate aerosols. And those that are using the spa are most at risk, but those who are passing by can also be exposed to aerosols. So proper maintenance and compliance with Ontario regulations will help reduce the risk. Next slide, please. So this is a list of other potential sources of Legionella. As you can see, there's a variety of different possibilities of where Legionella can grow. As stated by the CDC, in the absence of control, Legionella can grow in almost any water system if the temperatures are favorable for Legionella growth. We have highlighted ice machines here. There have been cases associated with ice machine use, and we have seen Legionella found in these units. So ice machines are often will contain water reservoirs that are located next to compressors, which can warm the water enough to allow any bacteria that may have entered to grow. So due to this risk, ice machines should be used with caution in areas with vulnerable individuals and should be cleaned and disinfected regularly according to manufacturer's instructions. Next slide, please. So now that we know how Legionella is transmitted, potential sources in the environment, and what conditions can allow growth, what do we do if we start to see cases in a facility? So the first step is to begin with an environmental investigation. Next slide, please. So before we can get into the various aspects of an investigation, it's important to consider who might be involved. And during a case investigation or an outbreak, there are a number of people or different agencies that are typically involved, and it's usually a coordinated response with participants having a variety of areas of expertise. So this table just helps to break down some of the roles and responsibilities of some of the typical parties involved. And I just wanted to flag the role of a Legionella water system consultant. The water system owner may decide to hire an expert, a specialist, or a consultant to support the management and operation of a water system. So as previously mentioned, water systems can be quite complex, and having the expertise to support with the operation and maintenance can be quite helpful. Next slide, please. So often one of the first steps in a Legionella environmental investigation is an environmental risk assessment. So what is an environmental risk assessment? Essentially, it's a multi-step process and should be performed at the most likely exposure location in order to identify the source of Legionella causing illness. And this can happen in collaboration with the water system owner or operator, a water system consultant, if they've been part of the water system, and the local public health unit. So the environmental risk assessment takes into account a number of factors, including the case exposure history that's collected during the initial investigation. So when potential exposures are identified from the case history, identification of sources will also help determine the appropriateness of interventions, such as shutting down potential sources. It will also help determine whether environmental sampling is needed. And if so, it helps guide the public health unit with their sampling strategy that should focus on the connection between the case and their environment to determine possible sources. The image that we have included here is from a CDC tool that can be used to support and walk you through conducting an environmental assessment. Next slide, please. Oops, sorry. Okay. So an environmental risk assessment typically begins before anyone arrives on site. So the first steps are usually the local public health unit will request to meet with the building owner operator, any maintenance personnel, or anyone with knowledge of the water system, and any outside water consultants. The public health unit may instruct the facility to temporarily discontinue the use of any aerosol generating items as a precautionary action prior to sampling. So the PHI or the public health unit may advise the facility not to implement any remediation actions prior to sampling, because the goal is to ensure that any samples to be collected are representative of the potential source at the time of exposure to determine if there's an association to the cases. If you can click one ahead, please. So the public health unit will likely visit the facility and collect detailed information about the water system, including any changes, any renovations, any recent outbreaks or illnesses. And if you can click ahead, they will often review documents, including maintenance logs and building water schematics or plans. And that CDC form that we saw in the previous slide is available online and can be used to document components of a building water system and potential sources of aerosolization to help identify potential sampling sites. And if you can click ahead, the public health unit may conduct a physical survey, if you can click, sorry, one more, to identify and assess all potentially aerosolizing water sources and assess the physical and chemical conditions of potential sources that are likely to support the growth of Legionella. And if you can click ahead, the public health unit will use all this information to develop a water sampling plan, prioritizing sampling points based on the case exposure history, any clinical laboratory information, and the environmental risk assessment. Again, as Maurice mentioned earlier, while there may be situations where environmental sampling isn't always recommended, healthcare facilities are an exception due to the vulnerability of the population and often the complexity of the water system. So the sampling results are then interpreted in the context of the investigation, as each investigation and outbreak can vary quite a bit. Next slide, please. So for environmental testing, using the environmental risk assessment and the sampling plan, swabs and water samples can be submitted by the local public health unit to the Public Health Ontario Laboratory for testing. The environmental swab vials that are used are not the same as clinical swabs, so nasal pharyngeal swabs would not be used for environmental Legionella testing. And when environmental samples are submitted to the Public Health Ontario lab, it's important for the Public Health Unit to include the investigation and outbreak number, the IFIS case ID, and record Legionella as the confirmed etiological agent. It's worth noting that facility water system owners and operators can also collect their own environmental samples that would be submitted by a private lab for testing. Next slide, please. Sample collection is very facility dependent. So samples may be collected from various wings or floors and rooms from different types of aerosol generating water sources like an individual shower, a communal shower, a hot tub, or faucets. All in relation to the case history, and there may be many samples collected and submitted to the laboratory for testing. Once samples arrive at the Public Health Ontario lab, water samples are analyzed by PCR with results available up to 4 days, and environmental swabs are analyzed by culture and results are available up to 14 days. Isolates from clinical testing are further analyzed by sequence-based typing for comparison to the clinical isolate from a respiratory specimen for source identification. Next slide, please. So now we're going to go through some actions that can be considered if you're dealing with a case or an outbreak in a healthcare facility. Next slide, please. So the immediate goal in every case or outbreak investigation is to prevent or minimize the risk by eliminating the exposure to water aerosolizing activities until control measures can be implemented. So immediate control measures and remediation can vary depending on the type of setting, the specific device, or the water system implicated. The intent of these measures are to stop the release of water aerosols from potential sources to prevent further illness. It may be possible to target immediate actions to the water system. So if it's a hot water plumbing or a hot tub or an ice machine, or parts of that system, so a specific wing of a building, for example, that are suspected to be contaminated. This can include shutting off systems until remediation can be implemented. So if a facility's water system is suspected as the outbreak source, the following actions can be taken with regard to water restrictions and control measures while the investigation and definitive management are pending. And some of these actions need to be considered in the context of the setting and the outbreak and can be very challenging. For example, implementing sponge baths instead of using showers can require significant staffing resources, and having considered a plan in advance on how to implement these types of actions can be very helpful. You may also avoid the use of water from faucets in residents' rooms to reduce the production of aerosols. So you can consider removing aerators. For immunocompromised or those with swallowing difficulties or risk of aspiration, you may consider bottled water for toothbrushing or drinking. May consider installing water filters capable of filtering Legionella and replace them according to manufacturer's instructions. Where possible, you may shut down any necessary sources of aerosolization like fountains or hot tubs. And for cooling towers, while it's not always possible to shut them down, especially in the middle of summer, water system consultants can support facilities with these challenges, and you may be able to remediate a cooling tower without having to shut it down. But every system is different and requires an individualized approach. Next slide, please. So it can be very challenging to pinpoint the source of illness. However, once the environmental source of Legionella has been identified, the next step for the facility or water system operator is to develop and implement a remediation action plan. And a remediation action plan should include disinfection procedures that are effective against Legionella, target the risks or sources associated with the case, and minimize the adverse impact on the equipment and building occupants. So it's best to consult with an expert, as a tailored approach is often necessary. The most common methods of remediating contaminated water systems are chemical disinfection, thermal disinfection, or a combination of both. And I'll reiterate that once Legionella within biofilm has become established in a water system, it can be very difficult to eradicate. Next slide, please. So disinfection is often varied depending on the system, the equipment, any costs, operator training, water chemistry, a number of different factors. And many disinfectants used to control Legionella in biofilms can be corrosive and may result in water leaks. So another reason to consult with an expert. So chemical disinfection, such as chlorine, is widely used to inactivate microorganisms and penetrate biofilms. It involves an increased risk of, or an increased level of chemical disinfectant. So this is shocking the system or shock chlorination, leaving it remain in the system for a set period of time and then flushing the entire system. The level of chlorine and the amount of time that it's applied varies. And depending on the system, it could be dosed at a low concentration for a number of hours or a high concentration for a shorter duration of time. And again, it's very system dependent, and these decisions can be supported by best practice guidance and the experts or the expertise of water system consultants. After disinfection is complete, all outlets are flushed and returned to normal operating. Thermal disinfection can also be used. It involves significant increases in temperature throughout the entire system for a set period of time, and then flushing the system until normal temperatures have returned. There are limitations noted with thermal disinfection. There may be challenges with material compatibility. Distributing adequate hot water at elevated temperatures throughout the system can also be a challenge. And there can be the potential for recolonization of Legionella if nutrients and biofilm cannot be purged. Either method requires significant planning, time, and staffing to ensure that the process is effective and to protect residents from exposure to chemicals or heat. Next slide, please. So once Legionella has been controlled or eliminated, we then need to consider prevention. An important piece of prevention is being prepared, and one way for facilities and water system operators to be prepared is by having a water safety plan that essentially identifies where the risks might be in your facility and how to mitigate them. And part of having a water safety plan is getting to know your system, which can be very challenging because often buildings have been around for years. The pipes and plumbing might be very old, and you may have to gather quite a bit of information. And there are some resources that are available to help develop water safety plans. Next slide, please. So this is just a quick schematic. The CDC has a toolkit that can help walk you through how to develop a water safety plan. And next slide, please. And if you could just click through to the end, this slide just shows some resources that are available from ASHRAE, from the CDC, and from the Cooling Technology Institute that provide some resources that can help with developing the water safety plan. And next slide, please. So to reiterate, once established, biofilms and Legionella are very difficult to remove. So this is why a multifaceted approach is needed. So the goal is to identify the risk, use multiple means to reduce the risk, and not one on its own can guarantee risk elimination entirely, but the intent is to control through multiple measures. And next slide, please. So just some conclusions and final thoughts. So as part of National Infection Control Week, our main goal here was to raise awareness about the risks of Legionella in water systems and healthcare facilities, ways to prevent growth, and how to respond if there's a case or outbreak. So some thoughts and conclusions. Legionella is found in the environment, and with the right microbial growth conditions and a means of aerosolization, vulnerable individuals in healthcare facilities are at risk. The most effective strategy for prevention is through control and management of Legionella within water systems. Next slide, please. And ultimately, the goal of a Legionella investigation is to determine the source of infection and prevent further illness. This is done by knowing your system, where the risks might be present, and ensuring proper maintenance to ensure the risks are mitigated. The local public health unit leads in a public health investigation, and PHO is available to support public health units with outbreaks and investigations as requested. And as Maurice mentioned, this is just an image of the Ontario Ministry of Health Legionella reference document that is available to support with Legionella investigations. And the next few slides are some slides with resources. And we have some acknowledgements of those that helped Maurice and I draft and develop the content. So I thank all of those individuals. And on the last slide there, there's some contact information, and we will open it up for questions.
All right. Thank you so much, Kelly and Maurice, for that wonderful presentation. Really helpful to sort of provide your perspective on the kind of the public health goals of these investigations and the relevance for healthcare facilities that often are caring for individuals who may be quite susceptible to Legionella. Okay, we will now move into the Q&A segment to answer questions from our live audience. And I want to welcome Anna Majuri back from the laboratory to address any questions related to laboratory testing. And a quick reminder to everyone, if you haven't already, you still have time to enter your questions into the Q&A pod. All right, so let's go to the first one. And I know you mentioned this, but I'm aware that this question comes up again. So I am hoping that you would be able to address this one more time. Now that long-term care homes are required to have air conditioners in every resident room, we have portable air conditioners. Is this an increased risk?
So typically, as mentioned, these window air conditioning units don't use water as a source, water within the units. So they wouldn't be at an increased risk.
Great. Thank you very much for addressing it. One of the questions is from somebody who I believe is working at a long-term care home. When the resident has respiratory infections, they send a specimen away for COVID, influenza, RSV. Would Legionella be tested, or do you need to request this testing specifically? Wondering if this is a question for Anna.
Thank you, Jinhee. Yes, the long-term care facility would need to request Legionella directly. We do not add tests without request.
Great,
so
thank you.
You have to purposely request that test.
Okay, excellent.
And keep in mind too, it's a different specimen type, right? So one would be a nasopharyngeal swab, and for Legionella, it would be a BAL, for example, or a sputum or something of that nature.
Great. Okay, we have another question about hospitals and some of the regulatory requirements. Given the concern about acquisition in hospitals, long-term care homes, other care facilities, which regulation in Ontario, or is there a regulation in Ontario that requires these facilities to have water management plans?
So as far as I'm aware, there is no regulation that requires this, but we strongly recommend that hospitals consider having a water management plan.
Thank you. Someone is wondering if swimming pools and overhead showers are a risk for Legionella transmission or aerosols.
So typically, oh, sorry, go ahead, Maurice.
No, I was just going to mention that the focus should be on the capability of the water system to aerosolize. So for overhead showers, I think the answer would be yes. And it also depends on the status of how the water is actually managed and maintained, if it's being maintained correctly to prevent the growth of Legionella.
And I was just going to mention quickly that swimming pools, we've also been asked whether like splash pads would be considered a risk. Again, in Ontario, similar to hot tubs and spas, they are regulated and are required to be maintained and disinfected. So the preventative measures are in place that would prevent the risk of Legionella, and also that aspect of any aerosols. So in an overhead shower, if there is Legionella contamination within the system, a shower head definitely could present a risk.
Great. There are a couple of questions about proactive testing of potential environmental sources. So any recommendations or any advice on water sampling in at-risk settings I'm assuming various sources, and there's one specifically also about a fountain in these types of settings, healthcare facilities, long-term care home.
So really that would be part of the water safety plan. So some facilities, it might be helpful to have routine monitoring to sample, to have a baseline or an idea to see if there is Legionella in their system, and also then to be able to act if there are concerns, or depending on if Legionella is present and what the levels are. But it's very, again, setting and system dependent, and might be considered as part of the water safety plan.
Great, thank you. A question about biofilms and whether there are any means to eradicate them.
So depending on where the biofilms are, they can be very challenging to eradicate. Oftentimes it may require, like we had talked about, chemical disinfection. Also, it's sometimes physical cleaning, again, depending on the system. If there's biofilms within, like, let's say a hot tub or a spa, for example, you may have to physically remove any biofilm that's present in order to effectively eradicate or remove it. But it can also take multiple attempts at remediation and disinfection to be able to successfully remove it. It can be very challenging.
Thank you so much. And I am recognizing that we are a little bit over. I wasn't watching the time or chat appropriately. So I do apologize that we weren't able to get to all of the questions. There were really great questions that were addressed. And of course, there were contact information. There was contact information provided by Maurice and Kelly in case there are some burning ones still to be addressed. So I want to, as we wrap up today's round session, I really do want to thank again Kelly Briscoe and Maurice Coppin and Anna Majuri for presenting and answering some of these really great questions. I also want to take a moment to thank everyone who joined us for today's event. It was a very popular session, and if there are if there's any feedback or specific requests to follow up from this session, you're welcome to address those and provide us your feedback in a brief and anonymous survey for today's session that you should expect in your mailbox soon. Please do try to complete this to help us improve our programming. So with that, I want to just thank everyone again and wish you a wonderful day. Thank you very much.